Good morning, everyone. My name is Lisa Hayes. I am the Executive Director for Rolling Start. I wanted to thank you so much for taking some time out of your really busy schedules to attend this very important webinar, The Hidden Wounds, Intimate Partner Violence, and How It Relates to Traumatic Brain Injury. Rolling Start is a Center for Independent Living, and you can go to the next slide. Thank you. So oftentimes people ask, what is independent living? It is more than just a center. We're a cultural movement and a program. We are a way of looking at disability that puts individuals first and the disability second. Centers for Independent Living work towards equal opportunity for people with any disability to share in all benefits of society. And we serve people with any disability at any age in our local communities who can benefit from our services. And the cool thing about Centers for Independent Living and what makes us unique and different to a lot of organizations is that we are disability led. So you can be assured that pretty much everybody that you work with at Rolling Start has some type of a disability. Next slide, please. So we're a cross-disability community-based organization, and we were founded in 1977. Our mission is to empower people with disabilities to live the independent life of their choice. We serve people of all ages and all types of disabilities, and how you qualify to get services is you just need to self-identify as a person with disabilities. Most of our services do not require any income qualifications. Next slide, please. We have many programs and services: independent living, aging and disability resource connection, traumatic brain injury, which is what we're going to be talking about today. We have CalFresh program, the CalAIM program, which is advancing innovation in Medicaid. We have veteran-directed care. We do emergency preparedness, vocational employment assistance, and we also have a really cool program called Voice Options for people who are nonverbal or have difficulty communicating. And those are a list of our services. At any time you are curious and want to get services from Rolling Start, just check out our website, and you can see how we might be able to support you. Next slide, please. So our Rolling Starts TBI program, we do a number of really cool things. We have an 8-week program called Living Well with a Brain Injury. We do a lot of information and referral, independent living skills support, community integration. So if you are in a hospital or nursing facility and you want to get into a home, we can support that. Housing navigation and assistance. We provide caregiver support largely through some of our partners, Inland Caregiver Resource Center, assistive technology access, employment services, benefits coordination, disaster preparedness, case management, and ongoing follow-up. And next slide. What makes our program unique is every person with a TBI experiences different challenges: memory loss, mood regulation, identity struggles. We tailor and support our program to each individual needs, because there is no one size fits all. If you are attending this as a survivor of traumatic brain injury, you know you've seen one person with a traumatic brain injury, you've seen one person with a traumatic brain injury. So it has to be specific to the individual. We provide ongoing support that adapts as people recover and redefine their sense of identity and purpose. Next slide, please. Supported individuals with traumatic brain injury experience homelessness to secure housing and employment. That's the transitions. We help people avoid evictions for several people who are at risk of homelessness or admission into a more restricted environment. We provide AT devices, that's assistive technology, tools to dozens of participants, and we've helped several participants enroll in education or re-enter the workforce. Next slide, please. And this is our contact slide. We will be sending out to everyone who registered the slide deck, so you don't have to memorize this or try to write it down. We'll make sure you guys get it. And if you have any questions, don't hesitate to give us a call. All right. And with that, we'll move on and get our program started. I am just extremely honored to have Kathleen Connolly be our keynote speaker for this webinar. Kathleen has over 30 years experience supporting victims of domestic abuse. Kathy recognized the link between abuse and brain injury. Now retired, she co-chairs the Brain Fox Valley Advocates for Survivors and works to expand community education and resources for brain injury support. And with that, I'm going to pass it on to Ms. Kathy. Thank you so much for being here. We look forward to hearing your presentation. Thank you.
Thank you, Lisa. I'm really happy to be here today because this is a topic that I feel is so important, and I'm excited to be able to share it with you. So we'll begin. Intimate partner violence and brain injury. Intimate partner, the person that we love, the person who's center in our lives. And sometimes these relationships can be very, very difficult and hurtful. So next slide. What is intimate partner violence? Intimate partner violence is kind of defined by oftentimes emotional abuse, physical violence, sexual abuse. It can involve stalking. It is not a lover's quarrel. It is a pattern of behavior, and I'm going to talk about that right now with you. Next. So what does an unhealthy or abusive relationship look like? One of the very first things that happens in these relationships is that the person isolates you from family and friends. They don't like your friends, they turn family against them by certain actions, and then they use that so that they want this relationship to be you and me, and with no one to be able to do reality checks with you. There's a lot of control. There are a lot of rules. They try to you try more and more to please this person, and it never works. Things get more and more convoluted and controlling. Oftentimes people are tied in with jealousy. If you talk to anyone else, they check phones, they follow you. If you're home 10 minutes late, they get very, very upset and grill you as to where you've been and what you've been doing. There is emotional abuse in the sense that they make you feel really bad about yourself. They make you feel stupid. They you, they make you feel like you can't really do anything right. There's economic abuse with this. Persons are not allowed to have a job, or if they do have a job, oftentimes their partner will work it so that they lose that job. And because then you're totally dependent on this person for economics, and that keeps you tied in because you can't leave when you don't have any money. Physical abuse comes into these relationships when none of these other behaviors work to control you. If you step outside the lines, if you disagree, don't do something that you are supposed to do, that's when the person will sometimes get physical to scare you back into compliance. There are also a lot of threats that can take place. Sometimes, as I've talked to persons, sometimes their partner will simply clean a gun in front of them. There was one woman I met with who she had a husband and one child. And when I asked her, has anything changed? Have you noticed anything different? She said, well, he put his gun by the fireplace and he put 3 bullets on the fireplace. We talked about this, and she did manage to leave that day because that was a sign of some pretty serious threats going on. Other threats would be if you try to leave, I'll hurt someone in your family. Threats to injure or kill a pet. If you try to leave, and also if you try to leave, I will kill myself. So those are things that can kind of keep someone hooked into that relationship out of fear. So if you're in a relationship like this, or know of someone in a relationship like this hopefully will help you identify the dangers, and that person is in an abusive relationship. Next. There are also 3 phases with intimate partner violence, and that can help keep somebody hooked into the relationship. The first thing is tension building. It's the very first phase, and it's where you're walking on eggshells, trying to do everything right in order to stop a blow up from happening, in order to keep abuse from occurring. But the second phase happens because it's not in the victim's power to keep the blow up from happening. That's only in the partner's who's abusive power. And so an incident takes place. Now, this could be screaming in someone's face. It could be pushing, shoving. It could get to that kind of thing. It could be, again, those threats that I just described. But it really is the peak of the tension. And then we move into phase 3. And this is really what makes it confusing and keeps people hooked into the relationship. We call it the honeymoon phase. The abusive partner will do and say whatever they need to do and say in order to keep the person hooked into the relationship, in order to keep the person, their partner, from leaving the relationship. So they promise this will never happen again. They say they're sorry. They might cry and beg the person just to not leave. Oftentimes they buy gifts, send flowers, just a myriad of things to show that they can be a good partner, that this possibly is a healthy relationship. And these things sometimes make a person feel guilty when they're thinking about leaving this person. So that makes it confusing, and it makes it hard to leave. The thing that happens over time is that oftentimes that honeymoon phase gets shorter, and sometimes it disappears altogether. And so you move from tension to threats and abuse and back to tension again. So if you think about this, if there are people in your life, if there are clients you work with, if there are friends, family members, where you perceive that these things are going on in the relationship, we'd love to say to that person, leave, get out. And really, oftentimes, that's the safe thing to do. But we really have to safety plan with the person. We have to say things like, you don't deserve to be treated like this. Oftentimes, if we put down that abusive partner, use names, bad language, tell them, that this person is no good, they will feel like they have to defend that person because, again, this is the person they fell in love with. This is the person where there's a romantic relationship. So those phrases aren't very helpful. So if you're really meeting with somebody or talking to somebody or they're talking to you, the important thing is to listen, to be open, to concentrate on them, not the abusive partner, and to try and to tell them that you will try to help them in any way you can. There's a national number for domestic violence that can be very helpful to people. And there are also local domestic violence programs. As a friend, a family member, or a caretaker, or a person who's meeting with someone in this situation, they can be very helpful to help answer your questions, and they can be really helpful to this person and in help in giving them support and direction. And sometimes it's very hard, but we need to hang in there with them because they might leave, and then that honeymoon behavior comes in, and they might return and to that abusive partner. So oftentimes family members get so tired that they just write them off. But it's important to just kind of stay within their lives in any way that you can, and let them know you're there for them. You can't fix it for them, but you can be there. Next. So why are we talking about brain injury with this? Because there's a very high potential for survivors to have a brain injury as part of the abuse. And brain injury is so dangerous because it can be irreversible. Survivors who are abused are more likely to have repeated injuries to the head because most of the time, injuries often occur to the neck and to the face and to the head. Survivors also have repeated incidents of this, which can make the brain injury, the trauma, even more serious. So I'm going to take a minute and talk about this next. So as I said, more than 90% of all injuries in domestic abuse occur in the head and the neck region. In addition, subtle injuries that are not identifiable through MRIs and CT scans can lead to symptoms. Oftentimes, those brain injuries may not show up on a scan. Injuries are often go unreported because oftentimes we don't ask the question. We don't ask someone if they've been hit in the head, if they've been strangled, but also if the perpetrator of the abuse is there with the person and you ask, have you been abused? They're not going to be able to answer honestly. And sometimes they're afraid that if they do reveal that they're having some issues because of a brain injury, they're afraid that this in court could affect custody, getting custody of their children, or affect in other ways. So there's a lot of fear with this. Next. The seriousness of this is that oftentimes with these injuries to the head or to the throat, that the person loses consciousness, and they may not even know that they lost consciousness, but that's a sign that this was a very serious incident. Over half of people report residual problems after an incident, and a study has begun even that shows that in later life, problems can really get serious. CTE stands for chronic traumatic encephalopathy. It's found in the brains oftentimes of football players. That's where the study really began because they were seeing that in later life, football players were having a type of dementia that was definitely affecting their lives. And it comes from repeated injuries to the head, repeated concussions. And this same thing occurs when you are a victim of violence, domestic violence, intimate partner violence over a period of time. And so they've begun to look at that. And so it's kind of interesting that this is occurring. Next. So when we screen persons who are victims of abuse, in these cases, the screening was done on women, and 58% screened for brain injury, 91% had been hit in the head or strangled, and 65% of those who'd been hit in the head or strangled received no medical treatment. So we can see those are very high numbers, and it's kind of scary when you think about it. I worked for Harbor House for a long time, and that is a domestic abuse shelter. In 2023, when we would ask people coming into shelter if they had ever been hit in the head or if they'd been choked. We use the word term choked because they understood it better than strangled. With being hit in the head, 80 persons were screened. Well over half, 63 said that they had been hit in the head, and 22 of those reported that, and now that's a fourth of them reported that this occurred 5 times or more. So you can see that it kind of jives with the national statistics, and that can really be serious over time. Next. So now I'm going to talk about what a brain injury is, because I think that's important for us to understand when we're looking at this whole issue. So there are actually two kinds of brain injury I'm going to talk about today. One is acquired brain injury. Acquired brain injury is a brain injury that occurs after birth, and it's not something that's hereditary. So it can be caused by an infection to the brain, and we know strokes certainly can cause some damage, sometimes permanent damage to the brain. And ingesting a toxic substance, sometimes when people overdose, that can have a great effect on the brain. And today I'm going to talk about something called anoxia, and that is when oxygen is cut off to the brain. The other type of brain injury I'm going to talk about is traumatic brain injury. It's often shortened to TBI. That is an injury caused by a bump or a blow or a jolt to the head, sometimes something penetrating the skull. Another word for brain injury is concussion. And that sometimes makes a lot more sense to people when you say, have you had a concussion ever? And this also includes shaken baby syndrome, because that affects does damage to the brain. Next. This is a picture of a blow to the head. Our brains are not a solid mass. Our brains are like soft jello. And our brains float within our skull. And the inside of our skull is not a smooth surface. I often think of it like stalactites, or, in a cave, things that hang down. We have little bumps and ridges inside of our brain. And so when that soft jello-like brain that's floating hits that rugged surface, that can do injury, of course, to that area. So you can see in this picture that if your head falls forward, your brain floats to the back. And if that bump is severe, the brain moves pretty quickly, hits the back of your head, and then with that force floats back, hits the front. And that same thing can happen side to side in our brains, because like I said, your brain is floating. So you can see in this diagram that reddish part shows that that part is what's injured when the hit occurs. Next. Inside of our brain, we have electrical and chemical signals that are sent by neurons. Neurons are, you can see that the pink part there in this diagram is a neuron. And that neuron sends electrical and chemical signals. And then there are some little blue strands off of that neuron. And those really are pathways that connect neuron to neuron. And so when I move my hands, when I remember something, those neurons are firing, and those pathways are carrying that information to where it needs to be. So when those neurons are damaged, they don't, within the brain, the neuron doesn't really regrow when it's damaged. We can make new pathways, those little blue areas that extend out. We can make new pathways, but that takes time. And so if that area is injured very badly, it can take a very long time before we say maybe get a movement back in our hands, or our memory comes back, or maybe our short-term memory. So it's just something it's just kind of an explanation of what really happens when there is a blow to our head or oxygen is cut off. Next. And then, of course, we know that there are different levels of injury that can occur. So sometimes we can get a mild injury. I think every one of us has at some time hit our head. Um, and we probably maybe had a little sore spot there, maybe not, but um, it pretty much did not affect our daily living a whole lot. That would be a mild brain injury. A moderate brain injury oftentimes is more severe. That might be falling off a ladder, hitting our heads. We might end up having to go to the emergency room. Um, this is one reason we really recommend helmets for some sports, for riding bikes, because those are the head injuries that probably lie in the moderate area. Severe could be a car accident, a really bad fall. It could be an extreme blow to the head. Um, and that usually is characterized by being unconscious for 24 hours or more. Now, when we think about these, we think that, with a mild head injury, say somebody hits you in the head, um, we might have a little concussion, but sometimes we think, well, that probably wouldn't affect you a whole lot. But what we're finding is that even a mild injury, for some people, recovery takes a very long time or doesn't occur at all. Also, with a concussion or with any kind of hit to the head, sometimes the symptoms, the problems that occur begin to occur maybe a few days later, maybe a few weeks later. Sometimes we don't associate what's happening to us, forgetting appointments, bad headaches. Sometimes we don't associate that with having had that head injury because there's a little lag time there. Next. So, head injuries occur from falls. Head injuries occur from being struck by something. Head injuries occur from traffic accidents, of course, assaults. It can occur from explosions. Oftentimes, veterans who've been in war zones where there are IEDs, these explosions. When that explosion happens, that pressure causes the brain to zip back and forth and get injured. And we know that with intimate partner violence, falls occur because a person might be pushed down some stairs, or a head might be slammed into a wall or into a floor. I remember meeting with a woman once, and I said, "Did you ever have, physical abuse? Did you ever get hit in the head or anything like that?" And she stopped for a minute and she said, "Oh, well, there was a time that my partner was slamming my head into the garage floor." She said, "But I put my hands behind my head like this." And then I went on to explain to her that that really wasn't giving your brain much protection. The outside of your skull, yes, but her brain was moving back and forth and getting hit inside of her skull. So, and then also intimate partner violence comes under assault also. So it really covers a broad range of possibilities. So, I think it's important to ask when you're meeting with people. It's something that we really don't do always. Have you ever had a head injury? Have you ever been hit in the head? Um, and how do you, now that you see that this can occur and occur in many different ways, I think it's important to ask that question because what I found when I asked the question when I was working in domestic abuse shelters, that I would get a lot more information than maybe we had gotten on intake. And there was there were a number of times when somebody really related more serious incidents than they did when they first came into shelter. And we want to ask a person, ask them if they're safe. Next. Now I'm going to talk about strangulation. Strangulation is choking someone, putting your hands on someone's neck, and it's A firm handshake pressure can cut off that oxygen to the brain. Within minutes of oxygen being cut off to the brain, those neurons are dying. Those neurons and pathways are being affected. So it doesn't take very long before someone can lose consciousness. And it doesn't take very long before death can occur. And that's the very scary part of this, is that this is probably one of the most serious things that can happen. When we screened persons who came into Harbor House for strangulation, 57 of 80 persons, that's well over half, identified having been strangled at some point in their relationship. And 17 of these 57 reported that it had happened 5 or more times. So there is a good chance that there possibly could have been some damage done to the brain from lack of oxygen. 1/3 of them reported having been unconscious, and 1/3 had also never seen a medical person because of the strangulation. Another issue with strangulation is that death might not occur during the strangulation, but if a throat is injured and swells shut, that person can die of asphyxiation within 24 hours or 48 hours after the incident. So I'm really driving home how serious this is. Next. So when we really look at it in the line of what happens oftentimes in partner violence, you can see that a slap, that probably less injury happens with a slap or a punch. That's a little more serious. A kick can cause more damage. A weapon certainly can cause a lot of damage or death. But at least with a weapon, you have a chance. You have a chance to run away or escape, maybe, survive that. But strangulation, you can't get away from that because oftentimes you go unconscious before you can break loose of that hold. And so, we look at homicide as the very worst ending for intimate partner violence. Next. And this is a picture. When someone is strangled, oftentimes when those blood vessels are broken, you can see the blood vessels broken in the eyes here, that redness in the eyes. But there are also, if you look closely at this picture, there are little tiny red dots. And those are called petechiae. And those little red dots mean that a blood vessel has been broken. And so if you have a friend or family member or are meeting with someone and you may not see redness in the eyes like that, but you might see petechiae. That's a very important time to ask the question, has anyone choked you? Has anyone strangled you? Demonstrate to them. Look for bruises on the neck. That's very important. So, and oftentimes, because they lose bladder control or control of their bowels when they go unconscious, that partner can use that. Now, number one, they might be very embarrassed that this happened, and that partner can use that to say, "Hey, look at what you just did," and they make it too embarrassing for the person to report this. Next. So as I said before, symptoms may not be immediate, but survivors may later experience memory problems, difficulty concentrating, fatigue. Now, this isn't just feeling a little tired. Fatigue is really, really not being able to function because you're so exhausted or just not being able to get on top of this feeling of fog. Mood swings or emotional stability can happen, headaches, and loss of coordination. Next. So we're going to talk a little bit about mental health and brain injury. Imagine if you're in a love relationship, if you're in a relationship where you don't know what's going to happen when you walk in the door, where you don't know what's coming at you next, where you're maybe out in public with a partner and they give you a look and you know that when you get home, there's going to be a big issue. There's going to be a problem. There's going to be a blow up. When you live like that, of course, you're going to have depression and anxiety and fear. Those things are just kind of normal for an unhealthy relationship. Also, when someone has a brain injury, and some of you who are listening to this today may have had a brain injury, the difficult part in that is your life can change within a minute. A car accident, an extreme blow to the head, and things aren't the same after that. And that triggers depression and anxiety and some of those kinds of feelings that we have. And then we also might have depression, anxiety, or other things that go on because of having a mental illness. And so you can see that with when these things are tied together. If you have a mental illness, and you're being treated for that, and then end up in an abusive relationship, that can make things much worse. And medication or therapy or the things that we're doing may not help if we're not looking at the abuse part or if we're not looking at the brain injury part. And so symptoms can overlap. Inability to sleep, loss of appetite, poor concentration, loss of interest. Those are things that can occur. So, do you see that we can come to a conclusion and say, oh, this person has depression, or this person has anxiety. They need medication to help them get through the day. But sometimes we don't ask the further questions. Have you ever had a brain injury? What's going on in your life? So those are important. We kind of put people into a box and we don't go further than that. And so we don't really give them what they need or help them get what they need. So that's why it's really important to ask the questions. Next. Does traumatic brain injury increase risk for substance abuse? And the answer is yes. Because part of brain injury, like I had just described, depression, anxiety, but also those terrible headaches. Sometimes those headaches can't be controlled with medication. They certainly can't be controlled with Tylenol or ibuprofen always. So people begin to self-medicate in order to help themselves. And this can lead to getting addicted, to drugs or to alcohol. And that can create, again, added problems, added issues. So one of the things that we found is that when someone comes into a shelter setting and they're using or they're drinking, sometimes they're asked to leave shelters and we don't go further to say what's been going on in your life. Because if a person is self-medicating, we may be able to help them go to other means to get their needs met. And we have a better understanding rather than being judgmental of the person. So, next. So what do we see? Summing it up, this is what a brain injury can look like. Missing appointments, misplacing items, being disorganized with paperwork, having a hard time following directions. We found that in the shelter, if someone's having a hard time following directions, say their cleaning job is to vacuum the living room and they aren't doing it, rather than saying, well, this person is not, cooperating with the program or whatever, if we ask, It may be that they're having a hard time knowing where things are at or sequencing. And so you have to sit them down in a quiet place, ask them what's going on, and maybe write out, this is where the vacuum is. This is what you need to do. This is when you need to do it. Sometimes people will have frequent outbursts. With a brain injury, it's hard to control emotions for some people. Sometimes, of course, the hard time remembering. Fatigue, getting tired very quickly, needing more rest, not being able to initiate tasks, getting from here to starting something can be difficult. Having a slow response time. So you ask the person a question, and it takes them a while to answer. So it takes our patience, to be able to sit and give someone time rather than expecting an answer to come right away. Next. Also, next slide. There we go. Thanks. They also, like I said, problems with drug or alcohol abuse, mood swings, headaches, uncoordination, dizziness, seizures can come into this. Being sensitive to lights or sounds, easily distracted, or lack of impulse control. So that's kind of what we might be seeing. Next. So why does this matter? It matters because it affects how we do our work. It changes how we do our work, and it makes us better at doing our work. It matters because if we have friends or family, or if we're a caretaker, it makes us better family members. It makes us better friends, and it makes us better caretakers because we're more understanding and we meet people's needs. Next. So it's important to ask the questions. This is just a screening tool that we used. Simply ask a person, have you ever hit your head or been hit on the head? If they answered yes, we talk about it. When did this happen? How many times? Have you ever been choked or strangled? Yes, no. When did this happen? How many times? If they answer no to both of those, we just stopped the questions. If they did answer yes, then we ask if they're noticing anything in their lives. Oftentimes, people aren't aware of what's happening after a brain injury, so this helps to give them self-awareness. Next. Okay, and before we go on to accommodations, I want to read you something written by a woman named Madeline. When my girlfriend was beating me up and I went to the police, they asked me all kinds of questions about how it happened, when, where, why I stayed, and lots more. It felt like they didn't believe me that a girl could be doing this to me. And the more they asked questions, the more I couldn't remember things. They said I must have been lying because my story wasn't straight, my dates didn't match, and then they said it didn't really happen. I wouldn't have gone back to her when said she was sorry. I got really angry and said some things I shouldn't have, and then they put me in jail and said I must be on drugs too. When I saw the judge, he didn't believe me either. He said I wasn't a reliable witness, and that was my story, not consistent enough to rely on. It was a long time before I learned that there was a reason I couldn't remember details in right order, or that I got more confused or more anxious at each question. And I lost my temper so badly. I didn't know that having been beaten could hurt my brain too, and that these things were because of that. It helps to understand what is happening to yourself like this, so you don't think you're just crazy or something. Next. So, what could we do to help? What can we do to make things better? We can't necessarily fix everything, but we can help, and we can help people find ways to make a situation a little better. So, visual challenges. Oftentimes if we see somebody wearing sunglasses indoors, what's the first thing we think of? We think, oh, they forgot to take off their sunglasses, or, they're hiding their eyes for some reason. They must be using. But maybe it's the fluorescent lights. And that's why we need to, rather than judge what might be going on, ask the question. And to allow use of sunglasses inside if the lights give them headaches. And also to reduce fluorescent lights. If we have an office and we're meeting with people, I think it's important to use lower lighting, because fluorescent lights really can be difficult for people who have light sensitivity. It makes it difficult for them to concentrate, to connect with us, and to keep going in that situation. Next, initiation and sequencing. Sometimes it's hard to get going. Sometimes, when people aren't meeting their goals or they're not following through, sometimes we go, well, they must not be interested in help. Or, they're just not really meeting goals in life. They're, and that, so that may be our first thing. Sometimes we go, oh, they're just lazy, but that isn't necessarily what's really going on. And so again, we need to find out what's really happening. And there are things that we can do if people are having issues with this. And one thing I like to throw in too is that, okay, I'm talking about brain injury, but some of these things occur with mental illness. Some of these things occur with other types of things going on in people's lives. And so having an openness to that really can help us work better with them. So technology can be very helpful. Reminders on the phone, being flexible with the schedule, sometimes just simply writing out the tasks. First, we're going to do this, and then this, and then this. But first of all, make sure the person isn't having issues with reading. We had a woman in support group who did not realize, she never shared with anybody, that she could no longer read because of all the head injuries she had. There are ophthalmologists who can help with that. But we can't just take for granted that everyone can read easily. Next. Fatigue and overstimulation. Now, sometimes people don't know that they're fatigued. I have a friend, Tom. He had a brain injury. He fell off a ladder putting up a storm window. He had been a well-known psychiatrist in the area, had to quit his job, had to quit work. 25 years later, he still has to be careful of the fatigue. And his wife would oftentimes say to him, Tom, you need to go lay down. And that would be the signal for him. He wasn't seeing the fatigue. And sometimes you can see it in people's eyes. There was a woman in shelter. I used to say to her, I could tell by her eyes, you need to go take a break. You need to go lay down. Limiting computers sometimes. If overstimulation happens, sometimes it takes someone days to get back to normal, to get rid of the fatigue, to get rid of maybe the headache that occurred. So it's important to kind of learn to do these things ahead. Using earphones to block excess noise. Headphones can help. So that's kind of what we could do with fatigue and overstimulation. Next. Sleep difficulties. That can happen so easily. All of us can have sleep difficulties. So, basically, finding ways that, if there are ways that help us when we have sleep difficulties, we may be able to share that with another person and say, hey, this is something I try. Why don't you try this? Next. Other executive functions. Practicing stop and think and act. And we all need that every once in a while when things aren't going well. Sometimes predictability, knowing what's going to be happening. And oftentimes, if we're meeting with somebody, and it could be a client, it could be a friend, it could be a family member, sometimes an hour is too long. It's too long a time. And so we may need to shorten that up to maybe 15 minutes rather than one long session or meeting in a week. Maybe a couple of short meetings are much better to help people. And I'm going to show you a tool too that could be very helpful on the resource sheet that I gave you. Next. So it's up to us. Identify, being able to refer people to help. That because once we identify, then we can figure things out better. And educate. Sometimes educating ourselves, educating the person themselves with what's really going on. Just like Madeline said, when she realized that it wasn't that, it wasn't her, that it was the brain injury that was, causing this. If some of those police officers, if that judge had been better educated, she might not have had the bad experience she had. And I just want to share one other one with you. This is Gail. I always thought it was my fault. I couldn't remember things the way I could before my husband hit me. It didn't help that people told me it was because I was stupid, or because I didn't care enough to remember, or because I must be doing drugs or drinking. I tried to tell them that it wasn't any of those things, but after a while I just started to believe them. Now that I know that it isn't my fault, that sometimes my brain just doesn't remember things the way it's supposed to, I feel a lot better. And I can tell others, it isn't me. It isn't that I'm stupid or lazy. It's because I have a brain injury. Now that I have learned new ways to remember things that are important, like appointments or job training, I feel like I can get back to moving forward in my life. Next. And as Lisa said earlier, the person is the expert, the person we're meeting with, the person we're talking with. So finding out what helps them, and walk the journey with them, work together to figure things out and to make the choices that will help enhance someone's life. Next. So we're at some resources here. One that I want to point out to you was it's the fourth one down, Brain Injury Association of Virginia. They have an advocacy toolkit. I love this. It really is working with people. It really is teaching ourselves and to teach people how to self-advocate. It's got some really handy tools in there, and I think that could be helpful. Also, the Substance Use and Brain Injury Workbook, that's the next one on the list, that has a checkoff sheet that's really helpful to identify things that someone is experiencing. And it also gives some accommodation suggestions. And then also, I did give you some accommodation sheets that hopefully you have a copy of. And those things can really help you in working with someone and work with someone. So now we're ready for questions.
Okay. I'm not sure if we're going to get questions in the chat. Oh, great.
Okay. Hey, while we're getting the questions, I want to share one more thing with you. This is called the Medicine Woman's Prayer. I will not rescue you, for you are not powerless. I will not fix you, for you are not broken. I will not heal you, for I see you in your wholeness. I will walk with you through the darkness as you remember your light.
Wow.
That? Isn't that good? Okay.
Kathy, that was such an amazing presentation. So informative. Loved all the resources. Thank you so much.
Thank you.
It's great information.
Okay,
All right, you want to, we have any
want me to
coming
read the
through?
question, or do you? I can read it. I've never been diagnosed with a TBI. Can I still be eligible for TBI services? I think so. Yes, it's depending on the services. In our local TBI support group, we have we have a growing number of persons there who have long-term COVID, and they're having a lot of the same types of things, brain fog, and things happening to them that people experience with a TBI. And so, yes, I think that of course some of these accommodations and some of these things are helpful to really anyone who's having some of those issues. Will my memory ever be able to recover? I can't really say absolutely yes, and I can't say absolutely no. Over time, um, some of those new pathways can be created, and yes, you can do some recovery along that line, and you can find tools that really help with memory. Let me tell you, at my age, I'm looking for tools, and it's not because of a brain injury; it's because I forget too. So it's not uncommon. Um, so I would say, that's a maybe. Are there any exercises I can do to promote my memory? There is a program, and you might want to jot this. It's called BEST, BEST, and it is on that resource sheet. But that occurs online twice a month on a Saturday morning. And it is specifically geared to this type of thing. Um, there are a group of people who they do a presentation. They talk about um, what can be done to help promote memory and with other issues. And then they have a meeting after for anyone who wants to join in, and they talk to each other about what has helped them and what's needed. So it's called BEST, and it's a very, very good program, and it's free. Is there a medication I can take to help with my recovery? Um, that would depend on what you need. I would say check with your doctor. If you have a neurologist, maybe getting an appointment and talking with the neurologist about that. Um, that sometimes a psychiatrist can be helpful. It kind of depends on what the issue is. So I would say definitely there are certainly medications can help with some things like depression, anxiety, whatever, and that can help with our recovery. But medical personnel kind of need to steer that ship. Can a TBI affect communication? Oh, absolutely. It can affect how our thoughts. So you know what you want to say, but it just isn't coming out, or it takes a long time to say it. It affects that. Sometimes people don't have patience with us with the communication, and so that can be very devastating. Sometimes when someone has a TBI and they are tired, fatigued, their speech gets slurry, and that makes it difficult too. So yes, it does affect communication. Have you seen a treatment that has a higher success rate than others? Whew. Um, the treatments depend on the person. So there are treatments that can be successful. There's something called, it's around here, it's called RX learning. And it kind of walks someone through from the beginning on some of the places where they have deficits. RX learning, I would say you might go online. Um, Again, the best program would be a place to explore that because people have a lot of experience. They've tried things. And then there's one of the things that I also gave you is Brainline. And that is a website that you can go to. And also the California Brain Injury Association um, would be a good place to start with this question also, because they have a lot of, they know what's available in your area. How do you go about being diagnosed with a TBI? Um, a neurologist can do a diagnosis. They do a series of tests, just like they do for someone, say, who has dementia or um, other types of issues. They will do a test for TBI, and then also a neuropsychologist. Neuropsychologists are people who are literally trained in how to identify a TBI. The trick there, of course, is your insurance and what that covers. My injury was more than 10 years ago. Can I still be diagnosed? Yes, yes, absolutely. Again, if you see your doctor, you could start there, or they might be able to then do a referral to a neurologist or um, a neuropsychiatrist, neuropsychologist. So but even though it was 10 years ago, it doesn't mean that you're not. If you're having issues, definitely you can still seek help.
All right.
Okay.
Thank you so much, Kathleen. We really appreciate your insight, expertise, and passion for this subject.
Great.
Cannot thank you enough.
Well, and thank you. And then I'm going to stay on for the rest of the workshop also. So if there are further questions down the line, if I can be of any help, I'll be here. Thank you.
Thank you.
Well, we've just had an exciting, great, informative presentation. And now at this time, we will be taking a 5-minute break. So give you time to get you some water, some coffee, some tea, or run to the restroom as we will prepare for our next presentation, which will be another awesome interactive presentation on breath work. Take your 5 minutes, be back right at 5 minutes. See you then. Welcome back, everyone. I hope you had a refreshed break and ready for our next presenter, who will be presenting an informative and interactive presentation. Let me introduce you to Ms. Kyla Pearce. Kyla Pearce, MPH, PhD, CBIS, E-RYT, Senior Director of Programs and Research, Love Your Brain Foundation, USA. Dr. Pearce, her, is the Senior Director of Programs, Research, and Operation at Love Your Brains, a national nonprofit that delivers evidence-based, holistic health programs for people with traumatic brain injury and caregivers. She has developed a range of TBI special evidence-based mindfulness, yoga, and social connection programs and integrated them into over 60 community-based and 30 clinical contexts. She recently completed an NIH postdoctoral research fellowship at Dartmouth College, and her mindfulness meditation teacher certification program was with Jack Cornfield and Tara Brock. She lives in Vermont with her husband, the executive director of Love Your Brain Foundation, and their 3 children. Welcome, Kyla Pearce.
Thank you so much, Joanne. Thank you so much, Joanne, for the warm welcome. And it's really such a delight to be here. Thank you for allowing me to present on a topic that has meaning to me. My brother-in-law had a traumatic brain injury, and we continue to support this community in many different ways through the organization that I'm affiliated with, which is Love Your Brain. So I'm here to bring, as the last presenter was talking about, some of the practical tools that can support different aspects of healing, well-being, and health after brain injury. Next, please. So as has been discussed, we know that traumatic brain injury is common, chronic, and complex. So you can see here in the visual impacting many different dimensions of our overall health and well-being. And we know that non-pharmacologic tools and interventions are both critical and desired. So some people would prefer to use interventions that are self-managed. And breathwork is a practice that has an evidence base, so has research that shows benefits specifically for supporting different aspects of recovery after TBI, but different methods and tools for adapting breathwork to address the unique complexities after TBI are often inaccessible. Next. And to dive a little bit more in depth to some of the potential complexity that happens certainly in the IPV community is there can be a co-occurrence of PTSD and TBI, but not always. And this will become, when we talk about some of the specific benefits of breath work, really honing in on nervous system regulation. This is why this kind of sets up more of that foundation for conversation. So big picture, we know that 6 to 7% of the US population will develop PTSD at some point in their lives. And car accidents are actually the most common cause of developing PTSD, and also are a common source of how people develop a TBI. And we know that best research indicates that about 16% of civilians with TBI will develop PTSD, and that nearly doubles in the military community. So much more common in the military community and veterans who have MTBI or concussion. And certainly after IPV related TBI, there is a heightened risk of developing PTSD. And why this is important is you can see in this little graphic that although there are some unique features of TBI and post-traumatic stress or stress disorder, there are also some commonalities. And next slide. So how can breathwork help whether you've had a TBI with or without PTSD? Next slide, please. So without getting too kind of in the weeds technically, many of you, I'm sure, have heard of our autonomic nervous system. So this is part of our nervous system that is divided into two branches, but there's also other branches or other complexities within it. But the two main branches are the parasympathetic nervous system and the sympathetic nervous system. And what the balance between these two branches of our autonomic nervous system are responsible for are really to allow us to respond to if there's stressful or threatening situations. We might need to have our fight flight response, so to galvanize our energy and respond in a more energized way, but then also to regulate it by activating our parasympathetic nervous system when we're more at a state of rest. And you can see here in this graphic that there are certain functions to our internal organs that are more activated depending on whether our parasympathetic, our kind of rest and digest part of our nervous system is more activated versus our sympathetic nervous system, our more fight flight response. And what can happen after TBI, as well as after PTSD, is there can be a dysregulation in the two. So there really needs to be a balance so that we can leverage both depending on what the environment is asking of us. But what can happen after brain injury, and some of you may feel this for yourselves, is that there can sometimes be a hyperactivation of the sympathetic nervous system. So you might feel kind of agitated, easy to feel irritable. There can be a heightened stress response, cortisol release. Other times, there can be sometimes a dysregulation where there can be more parasympathetic nervous system activation. There can be low mood, kind of a freeze response, sometimes challenging getting motivated. So the point here is, what can we do ourselves to help support regulation so that if we need more energy or if we need more grounding, calming influence, there are tools through breathwork that allow us to directly influence our nervous system, which is really empowering. Next slide, please. So let's actually do a little activity so you might be able to feel this. So one practical, well, let me pause. One way that you can distinguish which part of your nervous system is being activated is when your heartbeat increases. That's when your sympathetic nervous system is activated. So that's galvanizing more blood flow to your muscles to take action. So your heartbeat goes up, your respiration rate goes up, your blood pressure goes up. But then when your heart rate goes down, blood pressure goes down, that's when there's a switch to the parasympathetic. So what we'll try and do is actually feel our pulse as we do longer inhales versus longer exhales. And sometimes it can be easy to feel, sometimes it's hard to feel your pulse. So if this doesn't work for you, no worries. But what I'll offer is to find your pulse, and I like to do it either kind of here on the inside of my neck. You can also find your thumb and then go a little bit below your wrist and press into the space right here. So see if there's somewhere where you can find your pulse. And what I'll do is lead a few rounds of breathing. And so what I'll do is ask us to inhale more quickly and then take longer, slower exhales. And if the cadence or pattern of breathing that I'm offering doesn't feel right for you, you can just, no pressure, you don't need to do this. But let's give it a go. So as you're ready, when you found your pulse, just notice for a moment what the natural rhythm is right now. And then together, let's slowly begin to breathe in. And then open your mouth, long exhale all the way out. As we do this, notice your pulse. Again, inhale for 1, 2. Exhale for 4, 3, 2, 1. Inhale for 1, 2. Exhale for 4, 3, 2, 1. Inhale for 1, 2. Exhale 4, 3, 2, 1. Allow your breathing to return to its natural pace. And just take a moment to notice if you sensed any difference in your heart rate, your pulse. And if we were in a room together, I'd ask for some audience participation. But typically, what some people will notice is that the heart rate started to beat a bit faster as we breathed in. And then it slowly started to become a bit slower as we breathed out. So, what that is showing is that by changing the ratio of your inhales to exhales, that's how you can directly influence your nervous system, which is pretty amazing. You don't have to go anywhere. You don't have to take any medication. You don't have to resource any external things other than this kind of secret power that lives within you. Next slide, please. So here is a little bit, for those of you who are visual people, how to break it down. So if you think about it, there are really 4 parts to our breath. The inhale, the retention, you can pause at the top, and then the exhale, and then you can also pause at the bottom, like holding your breath. So by changing the ratio, next please, you can see here that I can change the ratio. So continue to breathe in for 1, and now exhaling for 2. And that lengthening of the exhale is what is activating our parasympathetic nervous system tied to our exhale. Next, please. So even if you start to inhale a little bit longer, but then continue to exhale longer, so exhaling now 3 seconds, that still is activating your parasympathetic. Next one. And then you might also choose to add in some breath holds. So here, holding it at the top for a moment, but then still exhaling for longer. And that's the key to activating the calming response within your body. Next, please. And then next. So this takeaway of extending your exhale activates your parasympathetic nervous system. So let's actually click 3 times and see if we can have all those come up. Okay, so let's just do this together. So what you'll see here is we'll start by simply breathing for an equal cadence. So not doing anything to our breath. And then we'll begin to inhale to the count of 2, and then exhale to the count of 2. And then I'll slowly add exhale to the count of 3, and then exhale to the count of 4. So let's give it a try and see how it feels for you in your body. So you might just move a little side to side. Place your feet a little more intentionally on the floor. You can relax your hands somewhere easy in your lap or by your sides. Just getting a little more settled in your body. You're welcome to turn away from the screen and either gaze somewhere that feels steadying for you or close your eyes. Whatever feels accessible, supportive, and calming for you. So first, just simply begin to notice your breathing. You might notice when you're breathing in and when you're breathing out. Nothing to change or manage, just simply using the breath as a way to anchor your attention right here. This breath that's constantly changing, but always with you as a source of support. And as you're ready, let's just take a cleansing breath. So together, breathing in and slowly breathing out, feeling a release. As you're ready, breathing in for 1, 2, breathing out for 1, 2. In for 1, 2, out 1, 2. In 1, 2, out 1, 2, 3. In 1, 2, out 1, 2, 3. In 1, 2, out 1, 2, 3, 4. In 1, 2, out 1, 2, 3, 4. Allow your breath to return to its natural pace. And just sense if you might feel your heartbeat or whatever is true for you right now. Just noticing what's happening, any shifts on the inside. And sometimes as you're learning new breathing techniques, and every ratio is different depending on the person's breath capacity. So sometimes even though you're extending your exhale, it might feel actually a little activating. So it's important to work kind of individually to figure out, maybe for you starting with just breathing out to 3 feels calming. Some people can build up to much longer, 6 to 8. But this idea of extending your exhale a little longer, just like if you were if you find taking a bath calming, or wherever you feel relaxation, our natural tendency is often to sigh. And if you think about it, a sigh is a simple way of breathing a little longer exhale. So you already know how to do this. You don't need me to teach you. So let's go to the next slide, please. And so equal ratio is balancing. So if you're feeling like, all right, I need a little bit of steadiness right now, trying to equalize your inhales and your exhales. And this is how counting can be really helpful, especially after TBI when attention can be impacted. Using a simple breath count of 2 when you breathe in and 2 when you breathe out adds a little extra kind of cognitive, a little extra, what's the word? Just like cognitive, a little extra attention. And so that can be helpful while still being pretty simple. Next slide, please. Yeah, and we'll keep going to the next one. Thank you. And then finally, by emphasizing your inhalation, that is what's activating your sympathetic or your energizing kind of your stress response. So if you are wanting to respond in an activating way, and if you're feeling low energy, low mood, you need a little bit of activation. This also can be an effective technique. However, typically I've found in teaching folks with TBI, there's more often a need for practices that help with more of a calming effect. So just being cautious with when you're adding energizing practices that focus on the inhale. But I'll talk about a research study in a moment that can be helpful here. But one technique is to do a kind of longer inhale. So I'll just demonstrate this instead of doing it together. So this could look like breathing in for 1, 2, and a short exhale. Breathing in 1, 2, short exhale. And again, breathing in a little longer, short exhale. So that essentially hyperventilation by rapid exhales is what helps to build energy. Next slide, please. So what this is pointing to is there are kind of 2 different approaches in how you can regulate the nervous system that's particularly relevant after trauma. So the 2 camps are bottom-up approaches and top-down approaches. So top-down approaches, and you can see in this little graphic, that includes like cognitive behavioral therapy or mindfulness-based cognitive therapy. These harness our executive functions to help us learn how to regulate our thoughts, identify our values, to help manage when we're feeling activated. Bottom-up approaches use our sensory tools like here yoga, EMDR, also breath work that are using sensory tools like the ratio of our breath or movement, kinesthetic kind of touch to help us cope with when we're feeling activated. And you might think to yourself right now, when you're experiencing stress or overwhelm, what are the signals in your body that let you know that? Sometimes it can be helpful to use top down approaches to, for instance, if I'm having an anxious thought come up, to label anxious thought and to help reframe it in different ways. So that's a top down approach. But also, if I'm feeling anxiety, there's usually like a tingling in my chest, my heartbeat starts to race a little higher. So for me, if I take a slow two count of breath in and a long slow count of 4 breath out, that's using my sensory tools to help bring a more calming effect. So just equally important and 2 different types of approaches. Next, please. And so what this picture is showing is that for all of us, what we're hoping to do is maintain a window of tolerance. So this is the optimal state where we can access reasoned, intentional behavior, respond effectively to stressful environments. This was coined by the psychiatrist Daniel Siegel to talk about what happens when we are getting dysregulated. And so what can happen is, and you might think about this for yourself, do you have a tendency to get hyper aroused, to feel emotionally stressed out, overreactive, unclear thought patterns, or hypo aroused when feeling stressed, a kind of shutting down, more depressed, unmotivated, not wanting to get up off of the couch? And let's click twice to show. You'll see in these little yellow circles that breath work are tools that can do both. So as we've been talking about, if you're utilizing more of the exhale focused breath work, you can support when you're feeling hyper aroused, more of a grounding to get back within your window of tolerance versus when you're feeling hypo aroused, so a bit drowsier, lethargic, fatigued. You can use breath work, focus on your inhalations to help build energy. Next. So I thought this was a really interesting study. This was done in the general population. So granted, this is not specifically with TBI, but what this found was that and I think this is also particularly helpful because often, at least in certainly my work, people can be introduced to mindfulness through meditation, which is a really powerful practice. And sometimes, depending on where they're at in their healing process, meditation may not be as accessible as an entry point to awareness practices as something like breath work. So this study was a randomized controls trial that was really looking at what's the impact of different breathwork practices compared to mindfulness meditation, looking at mood and arousal state, as well as some mental health outcomes related to anxiety. So in this study, there were 114 participants that were randomized to either one of 3 breathwork exercises or a mindfulness meditation. And over a month, they were asked to do whatever practice they were assigned for 5 minutes a day. So not a huge time commitment. And what the study found, interestingly, so I'll just actually point us to the graphic below. There were 3 different breath practices. One was called physiologic sighing. So that's essentially when you just exhale a little bit longer, which is what we practiced earlier. So that was a practice focused on parasympathetic nervous system or calming impact. Box breathing, which is a very kind of common breathing technique, is here in the middle. It looks like a little square. And thank you. Great. And what's that showing is that there's an equal ratio between your inhales, your hold at the top, your exhales, and your hold at the bottom. So this is equal cadence to help have a breathing practice that is creating kind of a steadiness, so an equal ratio between not trying to activate one side of the parasympathetic or sympathetic, but equalizing. And then the last one, cyclic hyperventilation. Here, this is one of those ones where as a longer inhale and then a short exhale. So these are activating practices with actually a longer hold. And then mindfulness meditation, that group were asked to have a kind of non-reactive, open awareness of their breath. And so if you actually go back to the full slide, thank you. What they found in the study was that breath work, especially the exhale-focused practice, had greater improvements in mood. So people felt a bit more positive when they were practicing the extended exhale. What they also found, though, was that breath work and meditation both significantly reduced anxiety and increased positive affect. So all the practices had benefit, and potentially the exhale focus one had the greatest impact on mood. So why I think this is so helpful is that it shows really there's many different practices, and it's really about you finding the one that works best for you. They all have potential benefit. So thinking about where you are in that moment, what practices feel accessible, um, is the best and most effective way to support yourself and towards your goals at that particular moment. Next slide, please. So that really is the question. What is your goal? So some of the high-level key techniques is thinking about, are you someone who in that moment is feeling like you need something to help down or upregulate you? So to create more calm or to create more energy. Using, if you are teaching, of course, a trauma-informed approach. So how to create a sense of safety, predictability, and control. So I will often explain briefly what we're going to do to start and sometimes demonstrate. And then there can be sometimes a hyper concern around doing it right, and really inviting people just to notice what shifts they're feeling in their body, and then always leave it if it's not supporting the goals in that moment, and empowering them to make choices about their own agency and how they want to approach the practice. For cognitive processing, and to reduce cognitive fatigue, brief practices, and you saw from that previous study that amount of time is validated, so supporting cognition with slow instruction as well. And then it can be helpful to include some tactile elements to reinforce interoception or connection with how you feel internally. So that might look like, and we can just try it together, placing your one hand on your low belly and one hand over your chest. And for a moment, just sense where you can feel your breath moving in your body. Do you feel an expansion in your belly? As you breathe in a little more deeply, do you feel this expansion rising up to the hand over your chest? Just sensing this expansion, this rise and fall with curiosity, perhaps a little gratitude for all the ways your breath allows you to live this life. Imperfectly, that's for sure, but still offering the goodness that can come from this life. Let's take a breath together, breathing in from belly to chest. Breathing out chest to belly. And releasing your hands if you've joined in. And then you can also add in some labels. So sometimes, again, for the attention regulation piece, simply adding in, notice as you breathe in and breathe out, you might label in and out So something as simple as that, or also can add some emotions or feeling tones. So as you breathe in from hand over belly up to your chest, breathing in a quality of thankfulness or appreciation, breathing out, feeling a release. Next slide, please. And then, so big picture, I know we're getting to time. For some suggested practices, if you are like, oh, I really need practices that can help create that quality of steadiness. So working on creating an equal ratio. So breathing in for 2, breathing out for 2. You can also simply do focus awareness breathing. So that's just sensing and noticing when you're breathing in, adding the in and out label or not. That helps us bring attention to the natural rhythm of your breath. And that can be regulating. Next slide, please. Calming if you're like, all right, I feel overactivated a lot, I'm really stressed out, have headaches, and need something that can create a bit more calm and ease and groundedness. Coherent or diaphragmatic breathing, where you're working on lengthening your breath cadence so that you're breathing 5 to 6 breaths per minute. Usually, I believe we're around 13 breaths per minute, so slowing things down considerably. The cyclic sighing, so that long exhale out. Ujjayi breath is used in yoga that helps activate your vagus nerve by that sound in the back of your throat. Or doing breath ratios where you're extending the exhale. So breathing in for 2, breathing out for 4. Next one. And then if you're someone who is feeling in need of energy, so using that breathing in, breathing out, more like a little more forcefully and quick. Breathing in, breathing out. Next slide, please. So a final practice that includes the label, I'll just offer, and we'll do this just for a minute or two since I know we're getting close to time. But this is actually a breathing Gatha practice that's used in Thich Nhat Hanh, a Vietnamese monk and peace pioneer and amazing mindfulness teacher. So I'll just offer this for the next minute or two. You're welcome to again turn away from the screen, lower your gaze somewhere that feels steadying, or close your eyes. You might take a little stretch, shoulders up to your ears, and release them down your back. One more time, shoulders up and then down your back. Allow your arms to be heavy and at ease, and allow your breath to flow. You might notice when your breath moves in and when it moves out in a pace that's just right for you. Allow your breath to be received by a soft belly. Sometimes there can be holding here, so really soften into your belly. Let's take a cleansing breath together. As you're ready, slowly breathe in, feel your lungs expand. Slowly breathe out, feeling a release. As you breathe in, know I am breathing in. Breathing out, I know I'm breathing out. In your own pace, you might, as you breathe in, name, I know I'm breathing in. And whenever you're breathing out, name to yourself, I know I'm breathing out. Shortening this to in and out in synchrony with your breath. As you breathe in, my breath grows deep. And as you breathe out, my breath grows slow. Saying silently to yourself, deep and slow. Sensing your breath flowing. And as you breathe in, I smile. And breathing out, I release. Smile, release. Smile, release. Once again, I'll take a slow, intentional breath in, pausing for a moment at the top, and a long, easy breath out. Just sensing how you feel as a whole. And perhaps if there's one thing that you want to take away with you from this exercise or from what we've talked about in my session. So, one small thing that's landed, you're curious about, and let that be enough for now. All right, next slide, please. So, some resources if you're looking for free, accessible programming that takes a holistic approach and weaves in breath work and other holistic health modalities. Love Your Brain is a national nonprofit that supports people with many different forms of brain injury as well as caregivers. And we offer different free programs that blend mindfulness, trauma-informed yoga, psychoeducation, nutrition, and community building. We also offer skills training for health professionals and yoga teachers who want to learn, for instance, how to adapt breathwork and other forms of holistic health approaches for TBI using evidence-based practices, and then also contribute to research and outreach around why a holistic approach should be accessible. Next. So for those of you who might want to try out some breathwork practices, we have a free program called Love Your Brain Mindset Online. It's a 6-week program. You can choose from a couple different tracks. You meet with a group of individuals with brain injury and or caregivers and either do a group discussion with some mindfulness and breathing exercises or a full yoga class and group discussion. Next, please. And it goes through a curriculum. Each week is focused on one factor that's been empirically shown to promote resilience after brain injury. So we'll talk about what resilience is, why that's different than recovery, what mindfulness is, what our intentions, how that's different from goal setting, and other qualities to support a sense of resilience and emotional balance. Next slide, please. We have a few trainings. If you're a clinician as part of this conference and are curious, feel free to check out some of our certification level trainings and how to adapt yoga for brain injury. Next slide. And also we have a free meditation library with 150 practices that are designed specifically for brain injury. There's some on sleep, which I know the last presenter talked a lot about, some breathwork practices to help with nervous system regulation and attention and mood. So check those out if you're interested. Next slide. And then just a thank you so very much for listening, for trying some practices, and always happy to hear from you and hear feedback. And I know we'll have time for some questions. So just again, thank you so very much.
Wow, that was really awesome. Thank you so much, Kyla, for your presentation and allowing us to go through some of those breath works. I feel great. So
Thanks,
our
Joanne.
first question to you is, I have a friend who has no short-term memory, maybe 10 minutes or so. This is the case for 10 years or so. Are there treatments that can help?
In terms of breathwork practices that can help with memory, I do not know specifically. And certainly there's research that shows breathwork can improve different aspects of cognition. So reducing mental fatigue, increasing attention. I don't know about memory, but Joanne, feel free to weigh in if you have thoughts, and hopefully I can try and find some resources and share.
We can look for resources, other resources, but I don't know that. Okay, our next question is, we'll be sharing questions here that we received. Okay, Go ahead. I can focus on clearing my mind because I live with a lot of distraction. What can I do about that?
Oh, this is such a great question because you are not alone. And I think this is such a common reason that people try different mindfulness practices like meditation and breath work and feel like they're failing and it's not working and then give up on them. So I think one thing that's particularly true about these types of practices is when we start to turn inward and just quiet our external distraction, we often notice how much distraction is happening internally. So you've probably heard of the kind of monkey mind where the first thing we really notice is how distracted we are. So there's a bunch of different techniques you can use, and so much of this depends on what you find grounding. So there can be techniques, labeling techniques, where you actually label thinking. This has been very helpful for me because it's so easy to get lost in thought, but then having a labeling practice, they're called soft mental notes. So it's not a judgment thinking, it's more of the mind, the mind is designed to think. And if our minds didn't think, we'd be in much worse trouble. So bringing some awareness and a bit of an action to thinking, and then orienting your attention to something you find grounding. So that could be something tactile, for instance. So really feeling the sense of the floor under your feet. That's why breath work can sometimes be helpful because you're really engaging with it. You're doing something active, lengthening the breath or shortening the breath versus just passively noticing, which can be like a big ask if you're feeling a lot of distraction. So I'd suggest doing something a bit more active, going outside. I know depending on where you live, um, may not always be the best choice, but if you have access to a place where there's like the woods or somewhere where the environment is a little less stimulating, but you can still be active and use your senses to help explore what feels grounding for you. Is it sound? If you sense the sounds around you, that can help get you kind of literally your attention out of your head. But maybe it's something a bit more internal, like the feeling of the weight of your body on your chair. And then notice your thought, come back to that. And the practice and the success is when you notice you're distracted. That's you're succeeding because you're noticing that. And it just takes some time to offer yourself some kindness and gentleness. So I hope that helps. And what benefits can breath work do for me? So I think the nervous system regulation is really a helpful one. So if you're feeling overwhelmed, stressed, anxious, it can help create more of a sense of groundedness, calm, focus. If you're also feeling distracted or like you're having trouble paying attention, by noticing your breath, even just simply noticing it, and when you get distracted, coming back to the feeling of the breath, the rhythm of your breath, the pace of your breath, that is rebuilding your attention regulation skills. Um, there's some research that shows it can help with chronic pain. So if you're feeling headaches or tightness, using more of the extended exhale techniques can be helpful. Or if you need some energy and you're feeling depression or a lack of motivation, there can also be a sense of kind of strength and true energy that comes from inhale focused breath practices.
All right. Thank you so much for your. Here's another question. How often should I do it to notice benefits?
Such a good
How often?
question. And I will say, for those of you who maybe did that exercise in the beginning where you notice the immediate change in your heart rate by just a few rounds of breath, there can be, you're able to impact your nervous system quite quickly. But in terms of kind of sustained benefits, I don't, I don't have a clear answer for that. That's the randomized controlled trial that I mentioned before. They did a 5-minute practice for a month. So I would say you would notice benefits before that. I would try if you did a 5-minute practice every week, but it'll be both kind of immediate, but then also longer term. Try sticking with it for a couple weeks and see what happens.
Okay. Okay. And are there any techniques that that be used during a panic or anxiety attack?
Oh, yeah, this is such a good question because when that's happening, you're not, the executive functions um, are usually uh, overwhelmed by the triggering that's happening in your body. So what I would say is to practice these before. So to really practice these techniques so that when you're having a panic or anxiety attack, you can use the practices that are activating your parasympathetic nervous system. So the ones that are focused on your exhale. So I would say something as simple as inhaling for 2, pausing at the top, and then a long exhale and doing that for 5 minutes. But this is an area where breath work could be very helpful.
Thank you so much. We truly appreciate all of your time with us and your presentation. Thank you and have a great day. We're going to turn
Thank you,
it over to
Jenna.
Natalia at this time.
Hi everyone, I am Natalia Banolos. I am the TBI specialist here at Rolling Start. This next person that I'm going to introduce to you, I have the pleasure of working with her over the past few months. Her name is Justina Kirkland. Justina is an educator. She's a veteran. She's a passionate advocate for accessible learning and disability inclusion. She's had over 15 years of experience in leadership and instructional design and has a master's in workforce education and development. She's been a facilitator with Rolling Start for a few years now, delivering programs like Living Well in the Community, and then since 2022, from brain injury to wellness. Her work focuses on empowering people through education, connection, practical strategies for living well, and she does incredible with care and commitment. So the time that I've had to work with her, I've seen how passionate she is about helping individuals with traumatic brain injuries. She brings her joy, her energy, empathy, just about with everything that she does. She doesn't judge, she just kind of listens. She creates an environment where people feel supported and understood. Justina is also a lot of fun to work with. She's professional and she brings like a lightness and a sense of humor that makes collaboration pretty enjoyable. So I continue to learn from her, and it's been a pleasure just working with her. So here I welcome you, Justina Kirkland.
Thank you so much, Natalia. Thank you all for having me today. I feel honored to be able to kind of share my testimony of the experiences that I've been through and where I am today. So, my name is Justina Kirkland. Like Natalia said, I'm a disabled veteran. I'm an educator. I'm a mother, and I'm a survivor of intimate partner violence. My story really, the culminating point took off in about 2016. Um, as a single mother of 2 children that were in elementary school, so they were very young. I was working and I had a very demanding job. I worked for a Fortune 50 company. And on the outside, it looked like everything was put together, but behind the scenes, everything was really falling apart. I had experienced with my partner at the time, just like many other survivors of abuse, many incidents of abuse, and each incident would just increasingly get worse. Um, One of the points that I really wanted to bring up is with abuse, there's not just the physical injuries that you see, but it's those invisible injuries. And the last 2 incidents that happened were the most violent. I had injuries that I received from from strangulation, which the strangulation led to blackout multiple times. I was struck in the head and in the face. My last attack from my abuser was so severe that my face was unrecognizable, and I had black eyes for 3 weeks. But although you could visibly see those injuries, the worst injuries were the ones that you couldn't see. There was a lot of confusion and memory loss and emotional dysregulation. And I didn't know what help I needed and how to get it and where to start looking for it. I didn't know that I might have had a TBI. I didn't even think to ask that. All I did know is that I was having difficulty thinking, I was exhausted, I was disoriented, and sadly, the biggest thing is I felt like I was alone. Another thing I wanted to bring up was the systematic failure that came with the system at the time. And I know a lot of things have changed since then, since 2016. But sometimes people that are trying to help actually end up hurting. So going back a little bit to my incidents, the first severe incident that came, it was at my house. I live in a very nice community with houses everywhere, and it was very embarrassing that at 11:30 at night, my community was swarmed with first responders. This included police, fire department, paramedics, as they were responding to an emergency call to my home from a neighbor. When the first responders came, they ask, "Are you okay?" And of course, at that moment, I'm experiencing severe embarrassment. I'm also a veteran. I'm a Marine, so I'm like, "Yeah, I'm fine." They asked what happened. I explained that I had been strangled, and well, at the time, I would call it choked. And that's about all. The visible injuries on me at the time, you couldn't really see. The incident just happened. And I was not asked by any of those first responders if I had blacked out or I wasn't assessed in any way. The paramedics didn't even look at me. I was not offered any medical treatment. However, I did receive a lot of stuff. I received a lot of judgment. I was screened on the spot by Child Protective Services, and they opened up a case on me as an abusive parent because I subjected my kids to emotional abuse because they saw me being beat up. I was at the time forced to give the names of all of my family members and friends that I felt were close in my support network and give their addresses and phone numbers. And due to a clerical error, all of my family members received letters in the mail saying that my children had been taken into emergency custody and that they needed to know if they would take my children. However, my children were never taken. This was never the case. So that was just something more embarrassment and more that I had to deal with at the time. So back to that first night, I did receive a lot of resources. That is what I did receive. I received a lot of resources from Child Protective Services and, places I could go and things I could do and things like that. And it was just a lot to take at that moment after what just happened, something I didn't expect to happen. I was told that that case manager was the emergency case manager and that within a few days, somebody else would be following up with me. And from the person that followed up with me, in about a day or two, I was told that if something like this ever happened again, that my children would be taken away from me. So with that said, that was very important. I expected that this would never happen again. And much like said earlier, abuse has a lot of phases. And I don't think that we've mentioned a lot that survivors tend to go back multiple times because you end up, like we said earlier, going through that honeymoon phase. And my abuser had told me, I'm so sorry. That was wrong what I did. And I will never do that again. That's not like me. I've never done that to you before. And I believe them. So after my children had gone to sleep one night, about, I would say, a month and a half later, my abuser wanted to come and talk about things. And I didn't feel comfortable leaving the kids. They were still, like I said, in elementary school. So I let my abuser come to the house after they were asleep and we talked. And we were trying to rebuild trust. And within a few hours, my abuser, was upset. And I was then beaten and strangled and held hostage for over 12 hours. And that was a really bad situation. So you think, hey, what would you do? I couldn't escape. I was held hostage. I didn't call the police not because I was fearful for what would happen to my abuser, but I was fearful for losing my kids, because I know they said if it ever happened again that my children would be taken. The incident ended up stopping because I was able to make a phone call to my abuser's friend, which then came over and took the abuser away and left me. I ended up, at the time, I was seeing a personal counselor, so I had gone to see my counselor, showed up with sunglasses, and she had asked if I had gone to seek medical attention. This was like the next day or the day after that. And I told her no. And she told me that if I didn't go seek medical attention, she was going to put in a notification to the police or CPS or somebody. So, of course, I was like, okay, I'll go to the emergency room. So I went to the emergency room with my sunglasses on, and I knew that it was pretty bad when, as soon as the people at the front desk see you, because when you go to the emergency room, they do an intake and then you sit and wait and then they take you back and it takes forever. They instantly took me back, put me in a neck brace, and took me straight to CT scans. And then, after you come back from that, you sit and wait. Well, what I haven't told you guys yet, and they didn't know, my supportive friend that had come with me was actually my abuser. And the doctors didn't know that, and the nurses didn't know that. So even while I was in the hospital, I was being abused, I was bitten, I was hit, and I was told not to cry. And so when I was asked questions about the incident, I couldn't be honest. And I just said I got in a fight. And they're like, well, where did you get in a fight? Just with somebody, just with a girl. And so, again, I didn't receive any treatment. So I received zero treatment and zero help. And I was treated as a risk. But I did get one thing. I got another CPS case. So that was something else I was dealing with at that time. My breaking point of all of this really became the biggest healing point for me. I had been experiencing so much trauma, both emotionally and physically. I was extremely stressed, both at home and at work, and it eventually broke me. So while I was at work at an event, I ended up having a mini stroke, which then ended up forcing me to go on medical leave. And at that time, the only thing I felt I was succeeding at was work. And so that really left me feeling alone and like I had nothing. While I was on medical leave, my company had a huge downsizing, and 85% of the company was let go, and that included me. So then, as the sole provider for my children and myself, I was in a lot of fear, a lot of failure. It felt like it was the end, but I have to say it was the beginning. It was really the beginning for me. I was able to look at that time and take that time as a time to heal, and eventually a new opportunity came. I received the opportunity to start in a new role as a victim advocate. This program I served with, I was able to help veterans that are receiving medical treatment, including TBIs and PTSD, as well as survivors of intimate partner violence, and help their pets and provide a safe place for their pets to go while they receive treatment and while they escaped. And I got to advocate and educate the community, case managers, police departments, sheriff's department. I even helped encourage new policies that were now enacted and how they approach when they go to domestic violence calls, and how helping pets can really change how they approach helping the survivor. So this also gave me the opportunity to kind of give back and not allow what happened to me happen to anybody else, and really provide trauma-informed care and empower the consumers of the program to really live the best life they could live. As I close the end of my story, I do have a couple messages, and the first one is to friends and family and those bystanders. After we have survived that traumatic incident of abuse, one of the hardest things to experience is when everyone wants to speak badly about your abuser. It's not helpful. It is a reminder of the bad choices we made, Um, ooh, sorry. Lost love and the pain that we're actually processing. We've been hurt by our abuser, but that love did not stop. We lost so much more. We lost the safety of feeling safe. We lost love, and mostly we lost ourselves. Well, I want you to know that when a victim returns to their abuser, it's not because we don't appreciate everything you've done and that we're ignoring help. You have to remember that when you go home, and whether the client is now in a safe house or at a hotel to be safe or with somebody else, that we're alone. And like I said, we lost everything, and that included ourselves. So we are in a very dark place. That happened to be the darkest place I'd ever been in. And after survival of something that should not happen from somebody that loves you, um, it feels like you're never going to get out of it. So the best thing for our friends and family and bystanders is don't rush to fix us. Don't try to fix us at all. Just stay and be present and see us and give us the gift of just you being there. Messages for providers and advocates. To a professional, ask the right questions and never assume that the person that is with the survivor is a friend and isn't their abuser. I happen to have same-sex intimate partner violence, much like the story that was told earlier of, well, you're a woman, they're a woman, this couldn't be that bad. Just making assumptions of things that you don't really know. So screen for TBIs, listen for memory loss, listen for confusion, that person being overwhelmed. Don't just see the physical bruises and swelling. Also, the biggest thing is remember that threatening survivors with consequences can lead to them not seeking help. So don't punish that survivor's pain, honor their survival. Lastly, I want to say my message to survivors is the biggest one that helped me get through is give time. There are going to be days where getting out of bed and brushing your teeth is going to be a marathon, and just know that that's okay. It might be your only accomplishment for the day, but that's enough for that day. Keep going, keep breathing, keep loving yourself, even if you feel that nobody else loves you. Remember, you're worthy, you're loved, you're not broken. You're going to make mistakes, and you've made mistakes, and this too shall pass. Your story isn't over, and you're not alone. And that's all I have, unless there's any questions.
That was beautiful, Justina. Thank you for sharing. There is a couple questions. The first one is, and we're gonna ask here, what kind of places did you go for help? I know you did mention, that I believe you said it was CPS who gave you some resources, but did you go, personally for any help?
I didn't use any resources that CPS gave me. I think that there was how overwhelmed I felt, but two, I was angry with them. Like I felt like I was the victim and they were treating me like a perpetrator. And I understand they were trying to protect my children, but it had caused like a reverse. Like I didn't want anything to do with them. I no longer talk to my counselor either because at the time I was angry because another case was open because she had called. And so I think the only place I did go is I was seeing a psychiatrist at the time, and the biggest help she gave me was putting me on short-term disability. And as time came and I healed more, the help I got, I did end up finding another counselor and building trust with the counselor again and starting down that road. But I never received any medical help besides taking that long term of medical leave.
And how do you navigate, family-oriented duties now? Do you have any issues? Because everybody's TBI symptoms are different. So how did you navigate those family-oriented duties?
At the time, I don't know. I just did. I just survived. Some nights it was cereal for dinner. Like, I look back and I wish I would have done better, but I just, I don't have the answer. I just did. Like, bills are on auto pay, and I just, you know, survived. I can't really even fully reflect back and tell you 100% truth. Would it be what I consider the best? No. But did I make it through? Yes.
Okay. And do the challenges continue, or what challenges do you still encounter?
Being 9 years post this incident, I've had a lot of time to heal, and I've had a lot of time for my brain to kind of catch up. And becoming a victim advocate gave me the opportunity to really learn about what I had experienced and learn about myself and how to heal. So I feel my brain has recovered a lot. I feel that what fully hasn't recovered is, like I was saying to a friend just recently, is I felt like I had already processed all my emotions on this event. And I didn't fully realize that I hadn't until I think yesterday.
Thank you, Justina. Any other? I think those were all the questions that we have here today. But thank you. That was beautiful. And, thank you for sharing such a personal story and such a personal part of your life. So, I think next we have closing.
Wow, what an incredible time. I hope you got everything you needed out of this topic. I'm sure this is not a one and done situation. We hope you take advantage of some of the resources that were offered. I just want to personally thank Kathleen, Kyla, and Justina. You really made this an incredible webinar, and I just want to thank you for your time and just, being able to share your stories and chances and opportunities for to continue on. The webinar is streaming live on YouTube, and I believe it will be available if you know somebody that could benefit from this conversation, from this topic, please link them to our website. We also have a link tree, our website, www.rollingstart.com. Follow us on social media. And in closing, we do have a survey that we would really appreciate if you could take for us. This will help us to create additional webinars that will be meaningful as it relates to traumatic brain injury. So if you visit our Linktree /Rolling Start Inc. to access all of our socials. It will link to the video that you've been able to view today. And with that, also it will, if you go to that now, you can take our survey. And we would really, really appreciate feedback to help us with future programming. Thank you so much once again. I appreciate the time you have invested with us today. And I just want to wish you a very great day and happy 4th. Thank you, everyone.